Most cerebral specialty, aka, okay, gang, let's take a second to think here. Are there any other services that we can consult? That is such a flawed view of internal medicine. That just pisses me off. Like, no, come on, man. Hey, what's up, guys? Happy New Year. Just looking at Reddit right now, and I'm like, what is going on? So let's take a look. Why are half the front page posts on this subreddit shitting on IM? Why does everyone hate on IM? Unpopular opinion. I love IM. So I haven't read any of these yet, but it seems like it's worth checking out, like what's going on the Reddit right now. So why does everyone hate on IM? Seems like a large number of frustrated residents hate IM. I find it to be the most cerebral specialty. There's so much to learn and so much thinking involved. Remember, the happy ones don't complain. There are plenty of IM residents who remain comfortable with their decision. Yep, loved IM residency, loved IM, switched from neuro into IM. So, okay. Combination of thousands of prelims not interested in IM, but forced to do it for a year, definitely, and thousands of residents only doing it because they're gunning for a specific fellowship. IM overall can be great, but probably at least 50% of people doing it don't even want to do it in the first place, and that's reflected in the opinions of a subreddit literally designed for complaining and venting. Couple that with those that applied IM as a backup because they weren't competitive enough for their first choice, and then you get a large batch of people who hate IM because they never liked it in the first place. Talk to someone who actually liked IM from day one, and you'll get a different perspective. I think this is so true. There are so many people who don't like internal medicine, but as somebody who has really enjoyed it and wanted to go into it pretty much from day one. I mean, I liked all the different specialties. Like, I have really liked IM. There's a lot of things that are, downsides about it. I am still jealous of other specialties for getting higher compensation and getting to work with their hands a little bit more and not have to deal with so much administrative and documentation stuff. But still, there's nothing quite like IM as a specialty in terms of like the crazy things we can diagnose, really just managing the patient while they're in the hospital and just like being that quarterback that people talk about, in some of my previous videos. Lots of disgruntled interns, including myself, on this sub. Sure, there can be plenty of learnings at times, but for most part, I feel like a note monkey. Yeah, and I've totally felt that way before too. In IM, it really can start to feel like you're a note monkey, especially at different institutions where the hospitalist or the internal medicine role is really just like a consult machine and they're not really making decisions on their own. I think that's not a great way to practice medicine. The hospitalist really needs to do a large part of the work before they ever decide to consult a subspecialist. And, consulting a subspecialist is always appropriate if you feel like you need more help, but there's definitely a lot of institutions where I've heard that it's just like a consult note monkey where you just write the note and you just consult for everything. Way more IM residents than any other specialty too. Obviously, that's a huge factor. A lot of people are going to complain. It's going to be a louder, crowd because there's more people to choose from. Neurosurgery, I'm sure people want to complain about that, but there's just like so few people who are actually doing neurosurgery. You don't hear it as commonly as people complaining about internal medicine. Love IM, but I really dislike the non-IM parts of IM. Even though we are nominally evidence-based, every attending decides to do their own thing and change up the plan each week with changeover, citing their own personal experiences for what they're familiar with, despite most of the time there being no known differences. The patient gets whiplash, I get whiplash, and the very act of changing the plan can make care worse. I totally agree with this. I'm starting to get to the point where it's like, wow, I know and I've used certain meds way more than other meds. I can't think of the exact example, but there were some times where some people wanted to choose certain meds, and I was like, oh, well, I'm more used to using this one. I feel like it'd just be easier, I'm more used to it. But in reality, I don't think there's a huge significant difference, and there's no evidence to suggest there's a huge difference. So when I'm attending, as long as the plan is relatively reasonable, I think, just going ahead and continuing with the plan is fine. I don't think we need to be making these massive changes to the patient's plans every time, a new attending comes on and prefers this medication over this medication. The dispo, insurance, and social work aspect of it is so draining. I went to school to be a physician. I am not qualified to be a case manager. Yeah, and this was one of the biggest surprises going into residency. You're like, wow, I actually have to deal with so much of this dispo work. And one of the things I found is that at certain hospitals, you do less dispo work than at other hospitals, but it is something that's inevitable as part of the specialty. You have to think about dispo a lot, which is a totally non-medical issue, and we receive no training on it except on the job training. All these times where you're like trying to discharge this patient and it falls through, and then over time you just build up, okay, this is what the patient needs before they go, but you never get any formal training in it. Seems to me that a lot of people who choose IM just use it as a means to intend for specializing. I mean, if there was a separate residency for people who just want to do hospitalist medicine without aiming for further specialization, there may be more satisfaction with the field. I agree, and I think a big problem is a lot of people who want to specialize then realize they don't want to go through 3 more years of specialty training, and then they're just stuck with hospitalist medicine, and they didn't ever want to do that to begin with. And so that's why the burnout rate is probably really high for hospitalists. That being said, I haven't really done it as a full-time attending myself yet. But I think that would definitely contribute. I went into IM, I wanted to do cardiology, and then in the end, I didn't feel competitive, or I just didn't want to, do additional training. Now I'm just stuck with doing hospitalist, which I never wanted to do to begin with. Obviously, that would be very draining, and you would not be enjoying your position. I love internal medicine, and I'm really proud to be an internist. I think it's the best specialty for me anyway. There's nothing better than when I get an undifferentiated patient, and I'm able to puzzle my way into a unifying diagnosis. It's so satisfying. Agree. As an ID fellow, I cannot be a good infection doctor without being a good internist. I feel many specialists forgot how having that good, solid internist foundation makes you a better specialist doctor. Some of the replies in this thread are on the money. Biggest specialty, so more people to complain, and a lot of prelims who are forced to do a year of it. But in addition to these factors, it does have a lot of things going against it. According to Medscape, IM has the second highest administrative burden in medicine, and doctors in IM are the least likely to choose their own specialty again. I can totally see this, and it's something that I really want us to work on as a specialty, is to reduce that administrative burden and burden of documentation. Like, we write such long notes, especially in an academic institution, and other specialties like my anesthesia friends, I'm pretty sure they just go, they do their procedure, they sedate the patient, and they write their brief little note about what they did, but most of it is just actually treating the patient rather than treating the EMR, pretty much. The problem is we do need to have thorough notes because people are going to come back and see our notes in the future, and these patients have such complicated medical histories that you do want to have a thorough note that actually goes through everything rather than a really short note that doesn't, that leaves out all the details. In my opinion, a lot of people choose IM because they are uncertain of what they want to do, and medicine gives you a ton of fellowship options down the line. However, people then get burnt out during the course of IM residency and then forego fellowship just to get out of training and become a hospitalist. So they are more or less stuck with something they weren't super passionate about to begin with, but rather just had a lot of options later on. Hospitalist medicine has a lot of things going against it as well. High chart burden, not much time with patients, lots of consulting makes you feel disempowered, and a lot of social work and dispo issues. I don't recommend medicine to anyone unless they are really passionate about it. I think it has a lot going against it. And I actually agree with this. I think for me, I did really like medicine. I loved being in medical school and learning about all the different pathologies that are possible. I really liked having a broad understanding and being able to understand, small amounts of every single little different disease process that could be going on, and then understanding the patient as a whole. Like, I didn't really like to just understand one part of the patient. But I will say that there are a lot of downsides to having to keep track of 10 different things going on with your patient, whereas some specialist comes in and ortho can just treat the hip fracture or whatever, and it's so easy for them to categorize in their mind. Orthopedics have to consider a lot of things, but I do think there is something to be said about keeping track of one main issue that the patient is having instead of keeping track of 10 different issues and every single med that the patient's on, the 15 different meds they're on. That can get really, really tiring in terms of cognitive burden and cognitive load. So yeah, I would actually agree with not recommending medicine to probably most people unless you actually really are enjoying it, because even I, as someone who really likes medicine, I have times where I kind of regret going into medicine because some of the other specialties just seem so much better, in terms of job satisfaction and, being able to treat the patient and be able to make a instantaneous, result on your patient when you're treating them. As a fresh attending in IM, I have zero regrets. Definitely love to hear things like that. Also, IM is hard. It's literal medicine. That's simply what I like. It's literal medicine. All of it. Can't even escape neurology in IM. And you will have pregnant patients and will deal with women's health. That was really random to throw in. And you will have pregnant patients and deal with women's health. I will say the amount of pregnant patients you have is actually quite low. When pregnant patients come in, you maybe get consulted and the OB team will be primary, but typically we don't just have pregnant patients on our service. And yeah, I will say that it is very, very difficult because in medicine, because it's so broad, this is the problem with all broad specialties is you're never going to feel 100% comfortable with every single subject or topic. So the volume of knowledge you have to know is just so high, and it's always going to feel like you're uncomfortable with something. Something is going to come up where you're going to be like, oh, I don't feel that confident about this particular issue. And that's a sucky feeling to have. Whereas where you're going in with ortho, you're doing your hip fracture every day, hip fracture, little nuances in between those. But overall, you become super, super efficient and super good at that. And that's the benefit of specializing. And sorry, I keep rapping on ortho because ortho is cool, but I don't know anybody in ortho personally. I don't have any friends in my friend group that are in ortho. And frickin' I had 19 CCU patients one day, and we consulted urology for this difficult Foley. And they're like, oh, you're complaining about 19 CCU patients. Well, ortho has 50 patients on their list. And I was like, dude, this is not even the same level. Okay, I'm a little bitter about that comment, as you can tell. Most cerebral specialty, aka, okay, gang, let's take a second to think here. Are there any other services that we can consult? That is such a flawed view of internal medicine. That just pisses me off. Like, no, come on, man. That's so rude. That's so rude to say something like that. Like, you're degrading the entire specialty, and that's why doctors that we aren't able to advocate for ourselves in terms of like getting better quality of life or advocating for better work conditions for doctors, because doctors are so elitist that they think they're the best and they hate the other doctors, and they all fight against each other, and they're all saying, oh, these specialists are stupid, blah, blah, blah. That's the problem. And, I even have a tinge of that too sometimes, where I'm like annoyed by some of the other, specialties out there. But like, this kind of rhetoric is why doctors are so bad at unionizing and actually getting good working conditions. And we're working 80 to 100 hours a week or whatever. And nursing unions, on the other hand, are super strong and really able to advocate for all of their members. You only pan consult if you are a bad internist. I like this one. Versus all the other specialties who can conveniently just consult medicine. Yeah, and I totally agree with this. Like, people consult us for like diabetes management and like hypertension management. It's like so simple. Or like heart failure management. It's so easy. Like, for us, it's really easy. Or hyponatremia management. They're like, oh my God, what do we do? Like, for us, that's hecka easy. So like, if you're saying, let's take a second to think, let's consult everybody, but then you're the one consulting us when you need help with like somebody's insulin regimen or like sodium. Like, come on, man, you don't know how to manage basic things for us. Okay. Getting very defensive here, obviously. IM is the primary admitting service of the hospital. Chances are we help others more than we ask for help. The only difference is when we help, it's perceived as our job, and when we ask for help, it's why can't they handle this on their own? I think this is totally true of emergency medicine too, because everybody shits on emergency medicine when they don't do things correctly. But it's like, dude, they're the front line absorbing all this like crap that's coming into the hospital, and they're telling which ones need to go to the hospital or can be safely discharged. And they are dealing with so many issues, even broader than internal medicine. And yet, when they don't they don't check this certain lab value that you need before you see the patient as a specialist, you like shit on EM. So this is something that's very common to any specialty where it's like a broad scope. This is like just the perpetual problem that occurs. If you have a healthy respect for your colleagues, you'll understand there are going to be elements of a give and take in the professional world. A lot of physicians lack the real world experience to understand this, especially if you spend most of your career in the academic bubble. I totally agree with that. The big problem here is lack of respect for others here when people make comments for this. And this guy got 38 upvotes, like so inappropriate. Like everybody agreed with this guy. And this I think is totally the right take. People saying IM consults for things just aren't realistic. Every service that admits patients does a lot of consulting because that's the nature of hospital medicine. And it depends on the comfort level / experience / academic ability of the attending. In my shop, there are IM teams that consult for everything, and then there are others that basically never do. All right, why are half the front page posts on this subreddit shitting on IM? IM sucks. 80% of the board agrees. It makes me feel not alone knowing so many other trainees share the same sentiment as me as a lowly IM PGY2. But it makes me sad and feel like I wasted my life to end up as a simple secretary. I can't voice these opinions in my program for obvious reasons. I just wanted to thank the community for sharing the same thoughts as me and for providing an outlet that cannot be found in real life. That being said, any tips on how to get over IM depression? How can I come to peace with my decision having to become a secretary? Where do we derive happiness from IM? I see people saying they find pleasure in thinking through problems and figuring out differentials, but there is no monetary gain in doing this. So how does this make you happy? I see the shittiest hospitals making the most money. If you're boiling everything down to what makes you money or what does not make money, then that is definitely the key to not being happy with the specialty that you chose. The cerebral part of coming up with the diagnosis should be in itself satisfying to you, and coming up with a differential and then nailing the diagnosis and then treating the patient. That should be satisfying. It should not be what gives you compensation or not that determines whether you're going to be happy or not with the specialty. I think that's the only answer to this question. And if you're not deriving satisfaction from the actual work of what IM does, then you probably didn't choose the right specialty. You're a second year IM resident, you still have time to switch to a different residency and still have a year's worth of credit from intern year. But there is also the chance that over second year, which is, arguably a lot nicer than first year in terms of the amount of thinking you get to do, that you may actually start to enjoy internal medicine as a specialty. But if you go in with this concept of, hey, I'm not getting compensated for this, then you're never going to be happy with internal medicine as a specialty. That's more of a procedural approach. So, it sounds like this person may be more beneficial in some kind of procedural specialty where they get compensated for each procedure that they do. You are asking why half the posts are shitting on IM, as you continue to also shit on IM. I've seen op pop up several times now regarding IM. I get that venting is cathartic. I do it too. But at some point, the energy might be spent doing something more productive. I agree. And just reading this post, you could tell this person's like not in the right mindset, like to actually answer this question. I don't think they wanted truly an answer to their question as much as they wanted people to say, yeah, internal medicine sucks. Like, we agree with you. This person wasn't really looking for a solution to the problem. They were just looking for more people to commiserate with them. Look, yeah, I mean, this sentence right here was definitely, the highlight of their post. I mean, oddly enough, some people derive happiness from things other than money. And this person says, like what? Like, come on, what are you contributing to the conversation here? Solving complex problems because it's interesting. Helping sick people feel better. I mean, isn't that the main reason most of us supposedly went into medicine? Connecting with people, etc. I still would have gone into medicine even if doctors weren't paid well, assuming the cost of education wasn't so exorbitant, because I think this is fun. How to get over it. Stop reading the junk coming from this subreddit. Where I'm at, we hospitalists literally manage mostly everything as primary team, 95% of the hospital. You only consult for specific needs or procedures. I manage alcoholic hepatitis and decompensated cirrhosis who have Billy of 30 and don't even involve GI. So yeah, the secretary stuff is BS. I practice good medicine and we are extremely valued where I'm at. I love that perspective. And I totally agree with, stop reading the junk from the subreddit. I think for me too, browsing the Reddit, it's very nice to hear people also complaining about things. It's a nice venting chamber. But at some point, it starts to color the way that you think, too. And, even intern year, I was kind of hearing some of the seniors complaining about, maybe our program or some certain things at our hospital. And at some point, I got really negative about our hospital. And it truly is the people you surround yourself with are going to be how you start thinking over time. So you need to surround yourself with people that you want to emulate. And then you also need to avoid consuming too much negative content because it totally does change the way you view things. You're in a New York City program? No wonder why you hate life. This is a whole other issue to talk about, but New York as a internal medicine resident does seem like a very, very tough location to do internal medicine residency. You have to reframe your thinking. I love the breadth of general internal medicine, and I only consult when I don't know what to do. It's great knowing there's a specialist to help out when I'm stuck. I totally love that idea too, having a specialist. I have a backup plan if I don't know what to do. It's great having that feeling like there's a kind of contingency or a backup there that's present. As a full-time hospitalist, I make $300,000 a year and I got to take a bunch of cool trips. Now that I've paid down my loans, I'm opening a DPC practice. That's the flexibility you have with IM. Agreed, there's so much flexibility in IM. I actually don't know what a DPC practice is. Hospitalist is one of the best gigs in medicine. I'm saying that as a radiology resident. Why do you think this? Radiology seems like a dream compared to this secretary life. 3 years of training, straight into a $300K plus job, highly sought after everywhere. Can diversify down the road if you would like. Flexible working hours, 7 on, 7 off, etc. Radiology has its fair share of BS as well. I love that they're including this in the post because it's just telling you that every specialty has its pros and cons. I see a lot of my friends start their lives earlier than me. In radiology, you 99% are expected to do a fellowship, so it's really 6 years of training. Radiology is extremely competitive, so most of the time residents don't have much flexibility in their location. You take what you get mostly. I'm stuck in some backwater town away from my friends and family and my SO, whereas in IM, I would have been done with my training by now, would have had a new car, and been planning my wedding. I'm about to start my dedicated studying period for the radiology core exam, which requires studying that rivals steps, while my program is still drowning us in call. Seeing my other friends who went into peds, IM, and already be done stings even more. I'm sure I'll be saying this is all worth it a few years from now, but the grass ain't always greener. And I actually did not know about how difficult all this radiology stuff, like in terms of finding jobs is, and doing basically a fellowship for everybody. Because yeah, I have heard that, somebody has to specialize in body CT and somebody has to specialize in like neuroimaging and all these different things. So actually the fact that it's even longer training, I didn't even take that into account because I have one of my closest friends from med school is a radiology resident, and he's telling me about like all their offers for like 600, 700K, and they're like sitting there chilling with their coffee, like drinking their thing. But no, truly, they are working hard when they're on shift, and seeing some of these is definitely giving me like a little bit where it's like, okay, maybe my specialty, internal medicine, is not as bad as I've thought about it sometimes. I am attending here. Yes, we get dumped on a lot and have to do busy work in terms of paperwork, but I'm telling you, the healthcare system would implode without us, and patients would have much worse outcomes. Specialists have their expertise and know a lot about a little, but they often don't have the first clue how to treat the whole patient, pulm care notwithstanding. Plus, when something like COVID comes along, IM and pulm and EM lead the way, while other specialties stand aside. Take pride in helping patients and becoming a diagnostician, and don't worry about what others think. And lastly, know that academic medicine is a niche of IM and not representative of the entire field. Unpopular opinion, I love internal medicine. I love internal medicine and truly enjoy my job daily. Yes, there are many days when I am frustrated by dispo/social worker or case management support being dumping grounds, but every specialty has aspects that are difficult. These frustrating aspects are 100% tolerable to me. I like being able to at least know some things about everything. Rounds can be tiring if they run long, but I really enjoy collaborating with other people/colleagues and talking about patients' problems to figure out what to do. In the end, the specialty that you choose is what you make of it. And no matter what specialty you are, there's going to be pros and cons. There's going to be upsides and downsides. And you're just going to have to roll with the punches, figure out how you can adapt to those specific difficulties, and then you will be able to really hit your stride, enjoy the work that you're doing, and feel satisfied by it and not be burnt out. And that's something that I'm continually working on too. I've had my doubts about this specialty as well. And, sometimes I do feel like, man, I made the wrong choice. But overall, I think there really are tons of positive aspects for working in hospital medicine. And if you recognize those aspects and you don't focus on all the negativity all the time, you will enjoy your job and you will find a lot of satisfaction out of it. Hope you enjoyed this video. Thanks again for watching, and I'll see you in the next one. Peace.